Hi everyone. I'm Saja and I am Student Experience Officer with EPHSA right now. And I'm really happy to welcome everyone. I see a lot of new faces, so I just want to introduce why we're doing EPHSA Talk. It's the 5th month and we have had altogether 10 speakers already. Every month, 2 speakers, and the objective of this EPHSA Talk is to bring together public health professionals to talk anything and everything about public health. And like usual, we have our 2 amazing speakers with us. So I would like to welcome firstly Sander de Souza, who is our first speaker. Actually, Sander was also our 2022-2023 EPHSA president, and he is a Parisian last year medical resident in public health at Lyon University Hospital and Lyon Claude-Bernard University. He graduated from Europubhealth at Granada and Maastricht, universities in between 2021 and 2023. And he worked at the main STI clinic in the Lyon region, and he's currently working for the Greater Lyon Authority at the Health Directorate and in family planning centers. His field of interest are vaccination, the impact of discrimination on health, along with sexual and reproductive health and rights. And today, Sander is about to talk on sex health is public health. And I'd like to give the floor to Sander. And welcome, Sander. Happy to have you here.
Bonsoir, good evening, everyone. So I'm very happy to see the person I already know, and I'm happy to know the people I still don't know. So my name is Sandra, as you told. I'm going to share my screen. I'm sorry, I have some problem with my voice because I don't know. I have some virus circulating for a few days after an amazing weekend with colleagues last weekend. Okay. Can you see my screen and can you see the first slide right now?
Yeah.
Perfect. So you told me I have 20 minutes and it's a good thing because I have 20 slides and it starts right now. So we're going to talk about why sexual health is public health. And I'm going to explain to you why. But first, I have to explain to you who I am. So I'm a medical veteran in public health, as I told earlier. I do a university degree about sexuality, birth control, and abortion in Grenoble, which is not far from here in the Alpes region. I did a master in public health, in infectiology, immunology. I'm going to talk about EPH later. And today my main activity is at the Lyon metropolitan area, working at the Health Directorate and in family planning center. And I have some parallel activity in the abortion center in the Lyon University Hospital. My journey in EPH, I did the first year in Granada, the second year in Maastricht, a placement in Brussels, my thesis about the substance of human origin, and above all, the expert group. I want to talk to all EPH students here. What do I keep from this year? A better feeling of legitimacy to talk about public health and, of course, European public health, international public health network, incredible people I met all around the world. Of course, as you can hear with my incredible English accent, better level in other languages, whether it's Spanish, English, or Netherlands, or in Dutch. I feel more comfortable to collaborate in European projects, and as well, that's what I plan to do in Lyon. And of course, I will finish by the best. An incredible group of friends for life that I have the chance to meet you within the past years, and I'm telling that to all the students who are finishing EPH, please, please, please do it for us. Enjoy every single day. It's very, very important. Okay, let's skip with the emotional part and let's talk about sex health. But first, where do I stand? So I'm a cisgender Black man. I'm a former LGBT student activist. I'm a physician, but a first-gen med, so it means that I don't come from a family of doctors. I live in Paris and Lyon, which is two big Western metropolises. I do public health for 6 years now, and I'm kind of a sex-positive person, so don't be afraid. Sometimes, and so a lot of you know, when I talk about sex, I could be a little crude, so don't be afraid to tell me if I'm talking too much crude when I talk about sex. Okay. How could we enter the subject? First, before getting into sex health, you have to question your representation of sexuality in general, and it might kind of feel uncomfortable, but even to work with sexuality with other person, you have to question your representation of your own sexuality. We all learn, the terms evolve, the vocabulary evolves, and you will make mistakes, and that's okay because the knowledge evolves all the time. You have to deconstruct everything you know about gender, sex, emotional life, family, friends, relationships, men, women, other kind of individuals, or social class. Nothing is obvious, and you have to forget everything you know before getting into the subject. Why is SRH, it's sexual and reproductive health, so important? For a lot of people, sex is a very important part of their personal life and life in general. There's a lot of links between sexual and reproductive health and the rest of health. I'm giving you one example, and for people in the chat, do you know the very, very first symptom of coronary artery disease? And if you have the answer, can you put it in the chat? Just write on this side, please. The very, very first symptom. Do you know it? It's a little quiz for you. The very first symptom. Do you know it? Coronary artery disease. Do you know the symptoms? Can someone answer in the chat, please? Does someone know? I see some answers. Yeah. Emma gave the right answer, but it's okay. For most of the people think that the main symptom of the coronary artery disease is the chest pain. You know, the pain you have just here on the left. I have chest pain. I have shortness of breath. I have difficulties to go up or go down the stairs. No. The very, very first symptoms, sometimes 10 years before having any trouble with acute coronary artery diseases with ICU and stuff, is the erectile dysfunction. So if you diagnose an erectile dysfunction, congratulations, you also might diagnose also cardiovascular disease. Any consultation in sex health can be the occasion to have many other subjects, but I'm going to talk about it in the next slide. And as I often say, when we talk about sex, we don't talk only about sex. We talk about feelings, inner life, sensitivity, relationship to others, access to rights, discrimination, of course, with sex, gender, and orientation minorities. And yes, I'm giving you one example with PrEP. PrEP, which is prophylaxis against HIV. If you come to my STI clinic and if you do a consultation, the time we're going to spend talking about the PrEP, the molecule and stuff is going to be very quick because this is not the core function of the consultation. What is the core function? We can talk about the comprehensive medical anamnesis, all the medical history, all the medication. We could talk about birth control, gynecological monitoring, if you have, of course, you choose vagina and stuff. We can talk about gender, sex, love life, your body image, how you feel. Very important in sex and reproductive health and in any kind of other professional. Don't forget, and please don't be afraid to ask if there is any history of violence. Very important. We can talk about tobacco. We can have an impact on sex health, alcohol, others. Also chemsex, which is the fact to have a sexual relationship having psychoactive substances. We can talk about vaccination because some STI are transmitted by sex. For example, hepatitis A, hepatitis B, and HPV, 3 kind of viruses that can be prevented by vaccines. We can talk about cancer screenings, whether it's the breast, the cervical cancer, or any kind of cancer we can talk about. And of course, if you come to a healthcare facility, you can take time to see if you have access to any kind of healthcare in general. And 7 minutes, I'm on time. You actually have to understand that sex and reproductive health is a special context. We deal with marginalized individuals, sometimes with people who are not related anymore to their family, their friends, with society, with some employment, very lot of social problems. Some of them have what we can call the combinations of different oppressions. gender, orientation, ethnicity, functional diversity, religion, and the fact that people can face different kind of reality that not only adds but multiplicate between each other. That's what we call intersectionality. And for some of them, just they have some traumatic relation to the healthcare system because they have a history of traumatic events with the healthcare system, and they have a mistrust towards the healthcare system, and you represent the healthcare system. And when they come talk to you, they're looking for a safe space, and that's why you have to create at all cost a safe space. There is a mutual discomfort. Do you have patients that don't feel comfortable enough to talk about sex with their healthcare workers? Most of them, the GP, the general practitioner. If you don't feel comfortable to talk about sex health with your general practitioner, please change your GP if you can change it. It's because it's not the right one. I'm going to be very crude right now, and I have a GP. I'm very comfortable with my GP, and if I have any problem with any part of my body, including sex and reproductive health, I feel comfortable to talk to my own GP. And that's why I know that it's the right GP for me. So if you have the choice, please choose a GP you're comfortable with. And on the other side, as a healthcare workers, a lot of them don't feel comfortable to talk about sex health. They don't feel legitimate. They feel the lack of knowledge, and also some physicians are some kind of conservative about the subjects. Sex health, reproductive health is any part of health. It's like any kind of medical history. It's like talking about tobacco, alcohol, occupation, vaccination, diabetes. And that's one of the technical messages I want you to bring home. Sex health is part of health, and you should consider it at the same level as the others. I'm going to give you some tips if you have to deal with patients in sex and reproductive health. Be careful at your verbal and non-verbal communication, the way you react, the way your face can react to what your patients say to you. Be careful of the formulation of your sentences. Be neutral, be not judgmental. For instance, if your patient hasn't told you I'm gay or I'm homosexual, just be neutral. Just use neutral words. Or you're a man and you have sex with other men, which is not the same than being gay and than being homosexual, for instance. People define themselves as men, as women, as gay, as straight, as bi. Just respect that. Respect their autodetermination. And also, in your verbal and non-verbal communication, you can look at them in the eye and say, okay, you can speak. It's okay. I'm ready to hear anything you're going to be able to say to me. Of course, no shaming, no slut shaming, no kink shaming. On the other side, no vanilla shaming, meaning that if you think that people could have a blend, flat, that kind of judgmental vocabulary, don't use that kind of judgmental vocabulary either. And of course, when you ask a question like, do you define as a man, as a woman, do you prefer men, do you prefer women, always leave a room for other or for, I'm sorry, I'm not going to be able to answer to your question. Don't hesitate to make the patient rephrase the words they're going to use. And again, when you're not judgmental, just set a clear line between what is the law and what is your advice. The law is consent. Consent is non-negotiable. And when you talk about PrEP, about condoms, about screening, that's advice you can give. And it's very important that you keep that line between negotiable and non-negotiable. When you talk about sex health, as I told earlier, you have your values. Every one of us has their values. Nobody's neutral. It doesn't exist. And sometimes patient is going to expose to you their values. And your values and their values, they will collide. And that's okay. You have to accept that. As I told, pure neutrality doesn't exist. And again, vocabulary evolves. You learn things every day. You will make blunders. You will make mistakes. You will do some misunderstanding, and that's okay. You just have to accept that misunderstanding and to explain with your patient if you have any problem. Okay. Next slide. I'm going to talk more in a more broader perspective about policy and politics. In French, we say la santé n'a pas de prix, mais elle a un coût. In English, health is priceless, but it has a cost. And of course, we would love to give all the money we want to every kind of social and health system. The truth is, we have limited money, we live in a limited world with limited resources. Knowing that, even knowing that, you have to know that wherever you come from, wherever you can hear me, health is a series of political choices. If a government funds or doesn't fund some part of health in public health, it's because of political choices. And that's why it's very important for us public health professional to have both the scientific knowledge, but also know where to push in the politics part to be able to move apart and advocate for what we think is right. I'm giving you one example, HIV. We don't have a vaccine yet, and it's very hard because not only, most of all, because of scientific and biological mechanism, but even without vaccines, we have all the tools to end the epidemic. We have all the tools not to have any new contamination. All we lack is political willingness. And that's what I want you to know in all the country you come from. I'm going to give you one example, which is France, which we can call the land of the free. In here, STI centers, family planning centers, abortion center, everything is 100% free. Always, all the time. You can have the right to anonymity. We accept everyone, all genders, men, women, non-binary, gay, straight, lesbian, everyone. And we can even deliver some medication for free, PrEP, antibiotics, vaccines, NSAID, which is ibuprofen, basically, paracetamol, acetaminophen, birth control, IUD, intrauterine devices, and emergency contraceptive pills. And also PrEP, which is 100% reimbursed, even if you don't have a health insurance. In here, we don't care. Come, we can talk, we're going to treat you, and then we're going to see if you can afford it or not. If you cannot afford, we don't care. Come, and we can still treat you. Birth control, reimbursed for people under 26. Condoms reimbursed or free for people under 26. And in some conditions, trans individuals' affirmation care can be reimbursed, which is also a very positive part of public health for trans people, trans persons. A quick talk about community health. That's not entirely my specialty, so I'm not going to talk a lot about it. WHO defines it as the environmental, social, and economic resources to sustain emotional and physical well-being among people in the way that advance their aspirations. And that's really what I want to say, and satisfy their needs in their unique environment. As you can see, the most important keyword in that slide is there. And you have to understand that in community health, any problems, any issue, any solutions comes first from the community, from the person concerned themselves. And they participate and they are around the table at the beginning, at the very beginning of any action you put in public health. And of course, it's not limited to healthcare, but also social, but also workplace, but also child, parent, family, and any kind of society. And the main problem we have as the academics we are is to find a synergy and a good balance between practice, experience, and also research and proper and also proper participation to more formal evidence-based. I'm giving you one example because we talk about sex health. Which have a center which is called Le Griffon, in English, the Griffin, like the fantastic beats in Lyon, because it's in the Rue du Griffon, in the name of the street. It is founded by what we call a community association specialized in public health and sex health. And this association is only for minority orientations and genders. Sorry. This center is only open to LGBT individuals and sex workers. The very first person you see when you enter in the center is a community healthcare worker, which is from the LGBTQA community. The very first person you see in this center is gay, is trans, is queer, is asexual. And it's very important that the very first person you see understand your experience. And yeah, it's okay. to understand that. They have an overall offer: STI, PrEP, endocrinology for trans individuals, proctology, which is the science that on the diseases of the anal canal, sexology, chemsex, we talked about it earlier. They have machine that can treat you in 90 minutes on the center. And of course, the consultation are free if you have a social security card. The messages I have for you for community health, and I have 2 minutes left. You have to include representatives from the target population you're working with. It's very important. If you work with, I don't know, a community of a woman in that neighborhood, you don't work for them, you work with them, and they have to be around the table from the beginning. Do with, don't do for the people. Pay attention to what you hear, not only about general sex health, but also the personal life, the emotions, the relationship, the experiences, the very intimate experiences. We learn a lot of things in our books that some person should receive these treatments. You have to adapt this to each kind of person, the values of your patients. I'll give you one example. Grater, which is an app for men who have sex with men to meet. You cannot work in sex health if you never saw what Grater is. You have to understand how it works, how people send messages. And I'll give you one example later. And if you're interested in sex health, join us, because we are a community of very enthusiastic professionals all over Europe. Talk to each other, do groups, do formal, do informal groups here in your university, during the module in Rennes, after, before. Public health alone is not public health. It doesn't exist, okay? And for more formal association, can give you the example of the European Public Health Association, EUFA, and they have a section which is SGMH, Sexual and Gender Minority Health. I'm reading 2 books this day, 2 books that's really very interesting, and that's very interesting about mainly gay men. One book is from Walt Alditz, and the other one from Alan Downs, who are gay psychologists who work with gay patients, which are very interesting to understand the psychology of what it is to be a gay man growing in this world. If you have any other idea, you can put it in the chat, and I don't have any other stuff. It's 20 minutes and 1 second. I would like to thank you. And if you have any questions, I am open to any of your questions.
Thank you, Sander. That was really interesting. And also, I think during our studies here in Poland, we used to talk about health systems, and France was always like one of the nicest ones. And just here to see, like, it actually reflects why is it one of the nicest, because it's free and everything is mostly free and it's all subsidized. And also, I really liked how the centers have LGBTIQA plus workers, so that they feel really welcomed and safe. That is something that lacks, at least in Nepal. And I also liked how you shared about the tips that applies to everybody, like being mindful about pronouns and being respectful and creating a safe space. So thank you for sharing that. And just so that our participants know that we will have time later at the end of the session for Q&A with our speakers. So thank you once again, Sander. Now I'd like to invite our second speaker, our fellow Nepali, and she is Sabina. Sabina will be sharing about her journey of sexual and reproductive health and rights advocacy. Sabina is a public health professional with more than 3 years of experience in advocacy around sexual and reproductive health and rights. Her work is centered around working with young people and persons with disabilities on issues of menstrual health, safe abortion, and comprehensive sexuality education. Sabina graduated from Europubhealth Plus from the University of Sheffield, UK, and Jagiellonian University, Poland, in between 2021 and 2023. Sabina is also a She Decides 25 into 25 Asian Youth Champion and has represented Nepal and advocated in different international platforms such as Women Deliver conferences and Nairobi Summit in 2019. So I would like to invite Sabina for her talk.
Thank you, Souza. It was a wonderful presentation by Sander, and I think we're connected in some way, that he's presented like how sex health is a public health, and I'll be talking around the area of sexual and reproductive health advocacy, probably something new, because that's how I felt when I was working in this area. And I will start my presentation now, hopefully to keep it under 20 minutes. And I'm happy to see a lot of my friends. Like it's been a year since our graduation, so I'm happy to see a lot of friends joining in. And thank you for this support. Um, so my work, I mean, this is something that is something that I felt that was something missing in my undergrads, and something that I learned as I worked, and something that I felt like was not that integrated within masters in public health as well. So it could be something new for everyone. When we talk about sexual and reproductive health and rights and advocacy, these are like, it looks like big terms, but I'm trying to just break it down and just give a general explanation of like how sexual and reproductive, like what is sexual and reproductive health and rights and advocacy. Well, we all are public health, so we know the definition of WHO. So it also applies in terms of the physical, mental, and social well-being in terms of sex and sexuality, as well as reproduction processes and functions. So that is sexual and reproductive health. So how do we exercise sex and sexuality and reproduction in terms of human rights is what we call as sexual and reproductive health and right, sexual and reproductive rights. So there's sexual and reproductive health, and there's also sexual and reproductive rights. And advocacy, joining advocacy in terms of all this is that how does it fit? Like how do we raise issues around sexual and reproductive health and rights, and what can we do to bring about policy changes, or like what are the global processes or regional processes when we talk about sexual and reproductive health and rights and advocacy. I have some slides to talk about like how it looks like in a global perspective, and what is advocacy in sexual and reproductive health and rights. And then I will have some slides that will talk about like how I was able to be part of some of this advocacy directly at the national level as well as in the global level. This is a slide that talks about maternal mortality rate. And maternal mortality rate, it is considered as an important indicator when we talk about the overall health system of a nation. So I've randomly selected some countries. Some examples may be extreme. These examples may be extreme, but just to paint a picture on how reproductive health looks like in these three countries. You can see the maternal mortality rate in Nepal is 150 per 100,000 live births. That means when a woman gives, like when 100,000 live births happen in Nepal, 150 women lose their life. And in terms of Poland, it's quite low, that it's 2 per 100,000 live births. In the United States of America, it's 22.3 deaths per 100,000 live births. So this is how the reproductive health aspect looks like at the global scale, just a picture. And then this slide talks about one important aspect of sexual and reproductive health and rights is a decision to be able to choose to whom to get married. And I've again taken the examples of the three countries. In case of Nepal, same-sex marriage, it is not criminalized, but it's also not formally established and legalized. There have been some positive strides of government and Supreme Court ordering, like giving orders in terms of same-sex marriages, and like saying that they should be allowed. But we have yet to see like how will it look like in terms of when how will it look like that goes beyond the court procedures, like how will it look like when it comes to parenthood or when it comes to divorce. So these factors are still yet to be seen in the greater picture of Nepal, but there have been some positive strides taken in these aspects. In Poland, I remember when I was in Poland last year as well, there was discussion around, there were like so many, the right-wing government was present at that time, and there were discussions around like some cities were declared as LGBTIQ plus free zones. So there was a lot of polarization around the issue of same-sex marriage, and even with the left-wing government now in place, there's still discussion around that Poland is far from legalizing same-sex marriage. Whereas in the United States, it is legalized in all 50 states in the country. So we can just see a difference that a country's reproductive health system looks completely different, but their rights may look completely different and different as well. And one of the most contested issue and something that's very highly stigmatized and that is like highly politicized issue, something that even Sajja and me have been working in Nepal, or have like worked and seen it firsthand at the global landscape as well. In Nepal, abortion is legalized and it is available upon women's request, upon certain conditions, and is also available to save a woman's life in case of rape and incest. But in case of Poland, it is to save a woman's life. It's only available to save a woman's life in case of rape and incest. In United States of America, the recent development in terms of the federal laws being overturned, there have been like 14 states have a total abortion ban. So I just wanted to paint a picture that this topic of sexual and reproductive health is much more, it goes much more beyond states being rich and being able to invest this resources in health. Here, it's much more than that. It's a very highly politicized issue. So it challenges the country's values. It challenges the country's religion in many aspects. So many topics around sexual and reproductive health and rights are highly contested at the global scale. Since I think I've been able to paint a picture on how it looks like in different states, whether it's like be it the economic status of the country. I Further I would like to discuss, and this is a slide that I'll be talking about how sexual and reproductive health historically and even at present has been highly political. I think we have all heard about the Millennium Development Goals as well, and which was before the SDGs, and it is considered to be regressive in terms of sexual and reproductive health and rights because it had only few goals that were targeted specifically only to reproductive health, the topics that are easier to discuss in terms of maternal health and newborn health, but it focused less on women's rights, on reproductive justice. So NDGs were highly criticized, and there are global players that comes into place when we talk about like why sexuality, comprehensive sexuality education are not integrated into these global commitments. And one important global player in this is also the United States of America, which has a huge power, but is also highly conservative so in certain reproductive rights, and also highly conservative and then the conservativeness of the nation also depends on who rules the country at that moment, whether it's a Republican or the Democratic Party, and that is the then we that gives a context into the topic of global gag rule. I'm not sure if everyone's heard of this, but global gag rule, it is reinstated in the United States every time a Republican takes the presidential seat. And it's such a rule that when the global gag rule is reinstated, then they cut down funding, so federal funding that the government provides in lower income countries on lower income countries that focuses their programs on abortion. And it sometimes takes into such extreme that it not only takes on funding from safe abortion, but it also takes on funding from HIV/AIDS, but it also takes on funding from family planning services. So it looks like it's a very political agenda, and the representation in the United States of America determines the fate of a family planning program in Nepal. So we can understand how highly political Sexual and Reproductive Health and Rights issues are. And two important aspects that is very highly contested in the global forum is the comprehensive sexuality education and also adolescent sexual and reproductive health and rights. These are the two highly contested issues. I'm talking about the advocacy spaces that I have learned about, and that is something that I think can be an important resource for the audience that we have today. Is there are like important global commitments when we talk about sexual and reproductive health and rights advocacy, and there are three important. These are the main very important key players that have pushed the agenda of sexual and reproductive health at the global scale. The International Conference on Population Development, which took place in 1994, because it shifted the narrative from controlling of population, using family planning measures of controlling in population, to putting it into reproductive rights and the rights of women. And it like gave a broad definition of being able to choose to have children or not to have children, how many children to have, or to space the children. So it gave a comprehensive definition, and it also very highly praised for the fact that a lot of nations were willing to sign the international it's called the International Conference on Population and Development. And then we also have in 1995 another Beijing Platform of Action pushed on the agenda of International Conference on Population. And now, since it's come from MDGs to the SDGs, it has many indicators that is integrated within health, within education, that talks about sexual and reproductive health and rights. And while I've talked about these three important platforms, I wanted to highlight about these very technical terms. It looks like Commission on Population Development, Commission on the Status of Women in High-Level Political Forum. These three all relate to the ICPD, the Beijing Platform of Action Sustainable Development Goals. So basically, to understand this is that the nations have signed, a lot of the nations have signed like have been part of these conferences and have signed documents. So what happens in these advocacy spaces is that the governments review the progress of what's being done. Okay, so I've said I will ensure that women have family planning services. So how will it look like? So after like 1 year, how does it look like in my country? So these are the spaces where they go on and review about the different areas within ICPD or within Beijing Platform of Action or within SDG indicators. And these are also the spaces where, besides the governments, there's also spaces for civil society organizations, young people to participate and say that, okay, so you said that you want to ensure that women can decide if they do not want to have children. So where are our safe abortion services? So these spaces serve as an important platform to hold them accountable for the commitments that they've made, and also it also provides a space for us to say that, oh, you committed it, but what have you done? And these are the advocacy spaces. And now just talk briefly about how it looked like in my experience. An example of this is the Nairobi summit that took place in 2019, which was the 25th anniversary of the International Conference on Population Development, which I've already highlighted as its very important a milestone for the sexual and reproductive health and rights. So it's 2019, and then the Nairobi summit, the 25th anniversary, was going to be celebrated in Kenya, Nairobi, and there were a lot of advocacy processes that I was part of. First, I was part of local level consultations. That is, like there were a lot of civil society organizations and young and civil society organizations led by young people, which talked about, okay, so what do you want the government to commit to at the Nairobi summit? So what we did was we held consultation. We also made young people and a lot of civil society organizations understand what is Nairobi summit, what is ICPD, and what issues should we raise. And then based on these consultations, what we did was we developed documents, some of them as like position papers, which are very like advocacy things that we use, position papers. We made like call to action to say that, okay, government, we want these commitments from you at the Nairobi summit. So I was part of the local level consultations. And besides this, I was also part of the Women Deliver Conference in 2019 and the regional meetup of youth also in 2019. Women Deliver Conference was just, what would I say, like something to start the talk around the Nairobi summit in 2019. It brought around civil society organizations, young people from around the world, and then we met there in Vancouver. Then we discussed and we also we also discussed about the gains that we made in the 25 years and what next can be done as we move forward from the 25th celebration of ICPD. So I participated there, and then I also spoke in certain side events and as a youth. And then also besides the local consultations, I was also part of regional consultation, which is also held for a different kind of global advocacy platforms. And the ICPD was held in Bangkok, where the Asia Pacific youths we met together and we also discussed about. So, as a region, what do we think about ICPD and how does it look like at when we go to the Nairobi summit, or what commitments we want at the regional level? So, these were the discussions that took place, and there also we produced an outcome document that is with a call to action on what we wanted from Nairobi Summit as Asia Pacific as a whole. And then I participated in the Nairobi Summit, which was we also had Saja there as well. And then we also talked, and there I was a speaker it was a side event on ending state abortion by 2030. We also had government members come in at that time, and I think it was one of the most, our advocacy was quite successful, is that the youth commitments were also reflected in the commitments made by the government, because we submitted documents that stated, okay, we as youths, we want these commitments from the government. And when the government had to make commitments at the Nairobi summit, they also presented commitments that talked about inclusivity, that talked about young people, that talked about ending child marriage, that talked about comprehensive sexuality education. So it was quite, I think, was one example that we saw our actions, our like hard work translated into actions by the government. But we are yet to see like how it's going to look like. I mean, how it has looked like in the lives of the people. But we were able to at least bring it at the policy level. And I just wanted to point this out that this year in 2024, we are celebrating the 30th anniversary of ICPD, the International Conference on Population and Development. So if anyone is part of is interested in this, then I'm sure there are consultations happening in your country. There's regional places where you can participate as young people, as academics, as researchers, or civil society organizations, if you're working specifically in the area of sexual and reproductive health and rights. I'm a bit early, but yeah, that was my presentation. If anyone has any question, then I'm happy to answer. Thank you, Satya, and thank you, EPHSA, for having me.
Thank you so much, Sabina. It was really lovely. I think when Sabina was sharing, I could also reflect when we were together. We actually worked together, and we actually went to these advocacy spaces together, and it's very stressful in these advocacy spaces as a young person, especially because it's quite intimidating, and also a lot of young people are not there. It's just handful of us. So it's really nice to reflect, and also how you compared between different countries. And I think that's that really gives where we are, at least as a country where we are. Even though we're working so hard, I think it still needs time to reach to the level that other countries are in the world regarding to SRH. Now we'll open the floor. Yeah, Meng, you can go ahead.
Hi, good afternoon. Yeah, it was lovely hearing the experiences of Sabina, which is actually also my buddy. Uh, this is more of a question on like I've been hearing about declarations like a framework for sexual and reproductive health, but there is also a counter argument on sexual and reproductive health as very contextual. Like there are many things that have influences sexual and reproductive health policy within a specific context and specific country. So in these international gatherings, and when you talk about like what should we be doing at the minimum, how do you actually try to balance things out without overstepping some contextual boundaries or some traditions or some things that might offend, the general populace of a specific country, which is something okay for another country? So I think that's my question. Thank you.
Hi. Yes, it's always been a very political issue in terms of like what how SRHR looks like in different contexts. And one important aspect is that I think when we talk about it's like sexual and reproductive health and rights, I think there are like reasons that that I think that is the reason that so many things are not mandated. Like you can opt out of it. So the countries, when they decide that, oh, we are not satisfied with this aspect of okay, like for example, abortion is quite liberal and legalized in Nepal, but there are many nations in the world which are very conservative in this aspect. So there are spaces where the country can opt out, or they can say that I will talk about, okay, so I'm for the violence against women, but I won't allow it. And like abortion is against our religious values or other values, and we won't allow it. So I mean, there are spaces, and there are also the reasons that they are not mandated in all of these countries. Only certain things are mandated, but mostly SRHR is highly contested and not mandated in many situations. Even these global frameworks that I'm talking about, they are mostly something that the countries are doing voluntarily, like they have committed to it, but there are no like uh, if they are not able to complete those commitments, and there are no measures to make them accountable. So that gives them the space to leave. So there are spaces where they can decide on like if they want to be part of it, opt out of it, or it's not mandated, and there are no any regulatory or other conditions in terms of the five frameworks that I talked about. I hope it answers your question.
Yeah, thank you, Sabina. Thank you very much for the answer. Thank you.
Hi, yes, please. Tui.
Hiya. So my question is for both of you, because I'm hoping you can reflect on your experiences. And I have an understanding that public health is so broad, and all of us have like graduated and gone into like different aspects of public health. And yours are quite similar, focusing on sexual and reproductive health. And whether it's on advocacy or with Sandra, the more medical side of things, I think it'll be really interesting if we can hear from both of you and kind of know what skills you feel like you needed to have to go into those sectors. And if you can just tell us some key takeaways from like all of the years of experience you've had so far, whether it's been 1 year focusing on this sector, or if it's like Sabina, I know you said several years, Sander, you said 6 years. I think what are the key takeaways from these years of experience? How did you land there? And also the skills. So it's kind of 3 questions for both of you to just reflect.
Then you should go ahead.
Okay. Actually, I said that I work for 6 years in public health now as an educational or physician, but I just remember that in prevention and STI and LGBT stuff, it's like more than 10 years now. And thank you for realizing that I have more experience than I think. As I told in the slides, I think the most important thing, it's very complicated because I should say read books, listen to podcasts, watch to TV shows, and just as a clinician, as an experience from a clinical perspective, listen to what people say. Like, you will not be able to. I'm not be able. I cannot write a book about evidence-based opinion about this on that group because I don't have any statistical muestra sample. Sorry, sample, but I have collected a very large body of experiences from the people I hear, whether it's my patients as a physician or whether it's the person I used to do interventions to when I was a volunteer. Just listen.
And any key takeaways, Sander? In the whole decade that you've been working in this sector, is there anything that really stands out to you?
It evolves all the time. Be open-minded and accept the fact that the term, the vocabulary evolves faster than you, and it evolves faster than me, and I'm not getting any younger, and I know that, and that's why it's very important to keep up. But the best way to keep up is keep listening to the persons.
Yeah, I think Sandra was covered a lot around what I wanted to say. But I think in terms of skills and Zoe, I would say, like, I mean, this is something that I developed as I worked in this area would be, I think you need public speaking a lot, like pushing your boundaries really, because I'm not that much of an extrovert of a person, but then I started like trying to open up myself, because if you're doing advocacy you need to make sure that your voices, your issues are raised, so you need to take that step forward of like you're young people, you're said to like talk about the issue of abortion, so so you need to have those public speaking skills, you need to network well and try to see like which stakeholders do you need to interact with. That's also very important. And I think one important aspect is also, I think, like regarding if it's advocacy, then also learning how the advocacy process functions as well, because it's different from what we actually learn, because it's a very different thing that, okay, there are global commitments. So what happens in those processes? Like how do you engage in those processes? What do the governments do in those processes? Where can you make sure that your voices are heard in those processes? So I think to be able to, like Sandra said, like to be able to learn about these new mechanisms, something that's quite different and something that's usually not taught in school when it comes to public health, whether it was masters or bachelors that talk specifically around how these advocacy processes work. And I think research is also very important. And and I think and then keeping an open mind is something very important as well, because yeah, I did not learn about gender, sexuality, sexual orientation during my school years. Neither had I heard about comprehensive sexuality education. We just knew health education. So, trying to keep an open mind, and then as you work, you learn these new terms, and then you try to dive into this, and then you again hear different terms, or and keep an open mind to see, okay, so what do these things entail? If you have a closed mindset and feel like, oh, this is what I have, the whole process of unlearning, that's very important if you want to work in sexual and reproductive health and rights. I think if you're not open to unlearning, then it's a difficult area to work through. And I think that's my key takeaways, like unlearn what you've learned is what you need to do to work in sexual and reproductive health and rights advocacy.
Thank you, both of you. There's one question, Sander.
Yeah, I saw it from Tika. I can see it because I told you very positive stuff about France, like, oh, everything is free, it's wonderful, people can come for free, and everybody do that. No, not everybody do that, and that's the problem. That's my job. It's free. You can come. even if you don't have papers, even though if you don't have money, even though you don't have anything, you can come. And still, we have people who still doesn't come. And I don't know if it works in English, but I will say it in English anyway. If you don't come to the mountain has to come to you. The thing is, now it's free, but we have still very vulnerable person who doesn't come to STI center, abortion clinic, or stuff. It's what we call in French l'aller vers, which is the going towards policy, which means that we cannot stay in our centers now. We have to go where the public are, where they live, where they work, where they party, where they have sex, for instance. Because a lot of these very high-risk population, whether trans persons, sex workers, or any other marginalized population, they are afraid, they are scared, they are frightened to go to a center. So we have to do some rotation where we can go where people go. For instance, the STI clinic where I used to work used to go by the roads in gay sauna, in gay sauna, in festivals, in the mountains, everywhere where people live, sleep, work, have sex. We have to be there. That's why that's about my additional efforts. Even though if it's free, we have to bring that to people. It's very important.
Thank you, Sander.
Yeah. I think Zoe had another follow-up question. Like, what are the major deterrents? Is it fear, attitude, or is it lack of awareness? Yeah. What are the major deterrents? Why they're not coming to the clinics? Is it because of fear, attitude, or is it lack of awareness?
And I'm gonna tell you, of course, because I understand very well this question, and I'm not looking at the word deterrence in the dictionary.
Barriers, basically.
Yeah, barriers. As I explained earlier, the problem is being inside a hospital or a STI clinic or any official building can be frightening, just because you can be impressed. And again, some other people have bad experiences about contact with healthcare system. So if you have one bad experience with one healthcare worker, you're gonna have fear to talk to any healthcare worker. I think that's the main issue we have, because as I explained earlier, money is not a problem, and access is not a problem, but eventually it is because people don't come.
Thank you so much. We're also close to 1 hour, so thank you so much for taking out time, and also to our participants for joining in, especially and our two speakers for making time and sharing this wonderful talk. It was really lovely seeing both of you after a year. So yeah, before we leave, I think I would like to have one photo, if that's possible, if everyone can turn on the cameras.
Yeah. The photo, the tradition stayed. Thank you very much.
Yeah, it has to stay.
Yeah, please.
Yeah. Oh, it's really lovely to see everyone.
Some people are missing. Konate, Gaëtan, Grisela, Dominic, Katia, Melanie, Cecilia. Gaëtan, we don't see your pretty face. Where are you?
Okay.
Dominic! Sorry. Too many people. I'm going to do that in private message later.
Okay. Thank you so much, everyone. Yeah. See you on the next EPHSA talk. Thank you so much.
Thank you, Sander. Thank you, Sabina.
Thank you. Goodbye.
Bye.
Thank you. Bye, everyone.
Bye.
Bye, everyone.
See you.
Bye, everyone.